As both a dental professional and business person, you want your practice to be all it can be. The world is constantly changing, and so are the issues that face a dental team each day.
Well, if you consider dentistry a business, which it is, it's important that we cover our expenses and make a profit, just like all businesses. And being a business that deals with patients, we're very concerned about their safety and about operational flow in the office, that patients can be treated on a timely basis to keep the overhead low enough where we can keep our prices competitive with our competitors.
Safety has become a very important issue, particularly in the last 10 years or so because of attention to disease transmission. So we're very conscientious in handling instruments to prevent that possibility.
For a practice to keep up these demands and keep their practice operating smoothly, the dental team must be able to accomplish more while still having the one-on-one time to focus on their patients. We hope you'll agree that it's not enough to be good, you want to be perfect. So what investment can help your practice approach perfection? The answer can be found in 3 simple letters: IMS. IMS stands for Instrument Management System, and it's brought to you by Hu-Friedy, the world leader in dental instruments and instrument care. What is IMS? IMS is a dramatically safer, faster, and smarter way to clean, sterilize, store, and access your instruments, eliminating manual processing steps while enhancing chairside efficiency and patient care. Let us show you how IMS can address your concerns. Have you ever been chairside and not had the instrument you needed at your fingertips? How much time was lost? The IMS concept is simple. By systematically organizing instruments, clinicians are able to seamlessly complete their work chairside without interruptions.
We use the IMS system because of improved efficiency of instrument handling and for safety reasons. So the efficiency of handling means that all of our kits are set up with specific procedures so that a grafting procedure is one particular kit and those instruments stay in a particular order in that kit, and when they're used at chairside, I know what will be on hand for that procedure and the assistant does too. So setting up is faster and more efficient, and use of instruments during the procedure is more efficient.
Not having the right instruments right at your fingertips while you're treating the patient can cost, in the treatment of the patient, anywhere from 3 minutes to 10 minutes. When it takes time to go to another room and retrieve that instrument, maybe even open another package when you don't have all the materials that are present there, it not only interrupts the flow, but it takes away from the production time of the team.
How much do you spend annually on replacing lost or damaged instruments? IMS neatly organizes and securely protects instruments during the entire cleaning process. The result is significantly longer instrument life, which is also great news for your bottom line.
Since we started using the IMS system, there's been just no damage to the instruments. I found that some of the delicate instruments really have much greater longevity, and they're always in perfect condition when I use them.
Your operational cost with dental instruments, where you're frequently getting them bent, where they're rubbing up against each other during the ultrasonic cleaning process, and maybe they get tangled up in the wire mesh of a basket, that definitely increases the overhead of an office because you have to purchase new instruments more frequently than if they're handled in more gently in a system that prevents that damage to the instruments during cleaning and sterilization.
Have you or anyone on your staff ever incurred a sharps injury? IMS uses a fully enclosed cassette, thereby reducing the chance for exposure to bloodborne pathogens. Did you know that the largest percentage of sharps injuries happen during cleaning?
When we look at the use of cassettes, they are certainly included in the latest guidelines because of the history of efficiency and the history of decreasing the potential for accidental instrument accidents, as reported in multiple epidemiological studies. Of course, the bottom line is we've had significantly less reported sharps exposures, both in our clinical facilities and in our dispensary, where our staff people are handling literally hundreds of containers a day.
Having the confidence of knowing that you're providing a safer method for your staff means a lot to them and to your peace of mind.
In any dental practice, once or twice someone will injure themselves on an instrument, Cleaning instruments is one of the times that that is most likely to occur because you're rubbing a brush across sharp instruments, usually a handful of them at once. The IMS system allows us to eliminate that possibility from our practice, and as a business owner, the costs incurred when someone cuts themselves in the office nowadays has become a problem, and the subsequent liability. So any way we can minimize a potential cut or nick from an instrument that may have been used is paramount importance to our practice.
It makes me feel a lot safer to know that I don't have to scrub the instruments, because you don't know what's on the instruments. You know, there's blood, there's calculus, there's debris. You just don't know. So it's just so much safer now with IMS.
We know you work hard, but are you working smart? Practices that use IMS report time savings of up to an hour a day.
I think that the time saving for the staff is in the sorting out of instruments when we used to wash them en masse and dry them just en masse on the countertop. Now they're always in order in the kit that they came in, so there's none of the time spent in sorting out and resetting instrument kits. So inventory is easier to maintain. The speed of handling the instruments, I can't imagine how much time we save, but it must be something on the order of 30 to 45 minutes per day per staff member, which is quite a significant amount of time. Actually allows them to get out of the office on time.
Is your dental team working like a team?
An instrument management system for the staff, it takes away the stress of processing instruments so that now they can focus their attention on the patient.
IMS helps build teamwork by allowing your team to be professional, using their expertise rather than doing non-valued added tasks like washing instruments. IMS frees your team to assist you chairside, make appointment callbacks, have you ever considered what your patients see? We all know the importance of referrals from both our patients and from other dental professionals. With IMS, the instruments are virtually presented to the patient rather than scattered on a tray, boosting their confidence in your team and placing them at greater ease while in the chair.
We're very proud of the cleanliness of our office, and the IMS system is part of that. And we feel that when a second opinion comes to our office seeking some advice and maybe is unhappy with another office, there are many times where they often mention to us that it's a cleanliness issue. And we then take that person and walk them through the sterilization area and let them see what we do, how we care for instruments, and how we want to protect them from anything that could occur during their procedures.
As you can see, IMS isn't just an interesting idea or a promising concept. It's a proven approach that has paid off for literally thousands of practices worldwide. IMS addresses the 6 major concerns dental professionals face each day by allowing you more time to provide superior patient care, helping manage your assets and operational costs, allowing for safer practices while processing instruments, optimizing your office flow and productivity, supporting your office with tools that create a positive and dedicated dental team, and all while creating a professional, marketable environment. All in all, IMS helps your practice by creating a safer, faster, smarter, and more professional working environment.
I would have to say that in terms of putting this system into use, I was reluctant at first because it required us to make changes in our sterilization area, and that proved not to be a difficult problem to solve. And it has paid dividends ever since we put it in, and I'm very happy I made the change.
So if you want your practice to be all it can, step up to state-of-the-art processing. IMS from Hu-Friedy. How practices make perfect.